to the invited guests, faculty and staff, students, ladies and gentlemen, good morning. It's never been new to us hearing a statement, choose a job you love and you'll never have to work a day in your life. And remember that career has to start at home. I classify CMULHS as a home. I am hoping you too. CMULHS is a home. The reason, it's our first ever having us here together for our career guidance seminar. CMULHS is a home of ups and downs, or maybe sorrow or happiness. But at the end of the day, we fight, we overcome. Yes, you, I, each one of us. We always have a choice in life. However, we are always responsible for the choices we make. Welcome to our CMULHS Career Guidance Seminar. Dream big, make it happen. Good morning, one another.
New to this school. He is a graduate of this institution in the year 2006, and his baccalaureate degree, Bachelor of Science in Nursing at General Santos Doctors in 2010, which he became batch valedictorian. He also got his nursing licensure examination in the year July 2010, and his Doctor of Medicine at Xavier University School of Medicine in the year 2015. And he also passed the physician licensure examination in the year 2016. He also a school health consultant at Philippine Academy of Physicians in School Health in 2017. Currently, he is a university physician at Bukidnon State University and assistant professor in Xavier University School of Medicine. This person is my good friend, our good kaibigan, at the same time, a good kaibigan of our beloved Ma'am Donna. O, nangayon ko na ang blessing, no? Kasi ma-phone ko later ba, so basi mag-friendship over me. Pero, indeed, he is a good friend of ours, no less than Dr. Roy Daniel C. Alincastre.
So thank you for inviting me. I spoke here last year for your career guidance. It seems hindi na maklaro. But anyway, sige. So I usually start, last year I started with a game with a few questions. But now, I'm just going to ask one question. Still, there is a prize at stake. So naanay nag-study daw? Insa man to nag-study? Okay, so I will only count up to 10 because basig kusog ang signal diri sa inyong internet, then you will be able to cheat. Okay, so I will just count to 10, and whoever can answer all 4 will receive a cash prize. What are the 4 kinds of sex? 1, 2, si doggy, 3, 4, 5, 6, come in front, 7, 8, 9, Ay, naman. Sige na. Asan? Come here. What is your name and what grade?
I'm Kate Guide, sir, grade 12.
What's your name? Okay. Mr. Guide? Okay, sige. What are the 4 kinds of sex?
Oral, anal, and
What breed are you in?
Oh my God!
Breed 1?
Oh my God! Ay, ay, ay! Oh no!
Ibalik ini sa disclaimer. Disclaimer ha. Some
Why are you
images
blaming
and
me?
terms
Oh my
may
God.
may be disturbing.
Bakit mo yun una? Male, female, transgender.
You're too advanced. Okay, no. What's your name? Anyway,
Shantio Velasco from 7J.
on grade 7. Okay, what are the 4 kinds of sex?
Female, male, lesbian, gay.
Okay. Not quite. But thank you for your answer. I'm sorry, not quite. Okay. How about
Wakabok
what's your
sex?
name and from what grade are you? Grade 10. Okay, what are the 4?
Homosexual, heterosexual, bisexual, asexual.
Okay, thank you. Wala yung nakakwat, no? Those heterosexual, homosexual, those are sexual preferences, di ba? Okay, so, I started it with this question. This is a question from, I think, grade 9, from genetics. Yeah. Anyway, sige lang. It's okay. The 3 of you who came here, you come in may consolation prize later, ha? Duli lang sa banggan. Yeah. I'm not kidding. I'm not kidding. You approach me later after the talk. Anyway, so what are the 4 kinds of sex? Before I'm going to start with my orientation about the medical course, I would like to give you a short lecture so that you will teaser ba? Okay, so what are the 4 kinds of sex? Actually, what are the 4 types of sex?
Male, female.
Okay, so who knows what this is? These are chromosomes. How many pairs of chromosomes do we have?
23.
23.
23.
And the last pair of chromosomes are called the sex
Sex
chromosomes.
chromosomes.
Okay? The one in the circle. So we have XX. You will either have one of these 2, XX or XY. So these determine if you are male or female. This is what is referred to as genetic sex or chromosomal sex. The sex which is determined by what chromosomes you have. So that's number 1, genetic sex or chromosomal sex. Now, the XY chromosome, XX is female, XY is male. Okay, so the Y chromosome, which is only found in males,
Male.
has a gene called the SRY gene. Now, what does this SRY gene do? This SRY gene tells your embryo, you know what an embryo is, di ba? Okay. The SRY gene tells your embryo whether it's going to have a pair of testes or a pair of ovaries. So if you have an SRY gene, it's going to tell your embryo to form or to develop testes. Singular testes. Okay. So if you have a testes, then you are going to be male. Kung walay SRY gene because walay Y chromosome, by default, the embryo will develop ovaries. So in a sense, everyone is by default a female unless there is the presence of the Y chromosome. Okay? At around 8 weeks, 8 weeks old. That is why, kung magpa-ultrasound si mami nga buntis, before 8 weeks, wala dyan makita nga sex sa fetus. Ano man, wala pa man nag-develop. Okay? So the presence of a testis will then determine if you have a testis or ovaries. This is referred to as gonadal sex. So it pertains to to what gonads you have, whether you have testis or
genetic
ovaries.
sex.
Now,
Gonadal
your
sex.
testis, if you are a male, produces what hormone?
Testosterone.
Testosterone, very good. Now, the testosterone will then further tell your embryo to produce your genitals. Without testosterone, you are going to develop a vagina. But because of the presence of testosterone, the embryo will develop a penis. Now, when you have a penis now, that is what is referred to as your genital sex. So whether you have a penis or a vagina. Now, what is the fourth? So we have genetic sex. We have
genital.
gonadal sex. Gonads. And then we have genital sex. What is the fourth one? Supposedly, tulo lang na siya. Pero, in the course of time, there are people who are confused. They have ovaries. They have a vagina. Pero they feel that they are a male. That's why, i-include na lang dayon ang psychological sex or what we call gender. So, it refers to
Okay.
what you feel you are. So you may have a chromosome Y. That means you are male by chromosomal sex. You will have a pair of testes. So by gonadal sex, you are a male. And then you also have a penis hanging out. No matter how small or how big it is, you are a male by genital sex. Pero if you do not feel male, then by psychological sex, that's just for the sake of tolerance, no? Okay, so those are the 4 types of sex. Now you know. Okay, so now I wish I knew before I became a doctor. So what actually I'm going to be talking about now is what is a doctor? Why should I not become a doctor? And should I become a doctor? So I see a lot of people wearing white coats and lab gowns. So does that mean you want to become doctors? Okay. Also the last time a lot of people were wearing white. Anyway, I hope I don't know if this is going to encourage you or discourage you. So whatever it is, at least I already told you, huh? Don't say you were not warned. Doctor comes from the Latin word docere.
Docere.
It's Latin, and in the
To
1200s,
teach, to show, to cause, to know.
it meant to teach, to teach, to know, or to show, or to cause to know. So actually, the origin of the word doctor is teacher. That's why we have doctors of philosophy, doctors of management. It actually just means a person who is educated or learned or authorized to teach. Manang pasabot sa doctor. However, in the 1800s, it was used to refer to doctors of medicine now, or medicinae doctor. That's where your MD comes from, medicinae doctor, or doctors of medicine. It just means na a person who has an MD has studied hard enough and long enough to be qualified to teach medicine or to know medicine. Where doctors can work. Okay, so ako, I am, aside from being in the healing profession, I am also in the teaching profession. I teach young students. Actually, they're not young. They are already professionals. who decided to proceed to the medical course. Okay? So that's why you can, if you're a doctor, you can teach. You can have a career in the academe as a teacher. Okay? Also, you can do medical research. Mag-doktor ko tapos mag-research lang, dili nyo ginalang ang research. Diba you have your investigatory projects? There is a reason why in this high school, ginapush mo. Because research plays a very big role in the practice of medicine. How do you think your medicines work? Diba? So that's because of medical research. Now, aside from being in the academe and research, doctors, like for example pathologists, or doctors can also be in the diagnosis. What do you mean by diagnosis? Identifying the type or the kind of the disease. Okay, so especially pathologists, they work in the laboratory, they look under the slide, like for example, this, dili maklaro ang slide. That is actually a slide under a microscope. Unfortunately, it cannot be clear enough to show you that that is a slide of a penis. Sorry. Anyway, pathologists look under the microscope to see what types of cells are there, if the cells have cancer or not, if the cells are infected, and if a patient dies without the cause of death, these pathologists are the ones who do an autopsy to find out what killed the patient. Okay? So these are pathologists. Now, what else? Other doctors who diagnose are those who look at x-rays, CT scans, and MRIs, for example. All they see are black and white. These are doctors who committed themselves to just try to identify kung saan ang klase ng disease ang naa. So we have radiologists, no? And those who practice nuclear medicine. What is nuclear medicine? No, it doesn't have anything to do with nuclear bombs and so and so. But these are diagnostic laboratory or studies to determine, for example, if a person has cancer or not. Doing diagnosis or diagnosing or identifying diseases, the following is mas kilala ang doctors, no? They are known for treating or managing patients. So we have neurology, for example. Neurology deals with anything that is concerned with the brain, not just the brain actually, but the brain, the spinal cord,
nervous
the nerves,
system,
and every part of the nervous system. Cardiology.
Heart.
Okay, those who deal with diseases of the heart and blood vessels. What else? Pulmonology. Lungs. Diseases of the lungs. So for example, if you have asthma or if you have other lung diseases like pneumonia, the best person to look at you or to examine you will be a pulmonologist. Okay? What else? Nephrologist or nephrology.
Kidney.
Those pertaining to the kidneys or the nephrons. Gastroenterology. Doctors who deal with diseases of the gastrointestinal tract or the GI tract. Gastro meaning stomach, intestinal meaning intestines.
Small in the
Okay? Psychiatry. These are doctors who are paid to just listen. So if you don't feel very active or you just want to listen and you don't want to talk, this might be a good area for you. You are paid to listen to people. But these are also the people who deal with the worst kinds of patients. Why? Because these patients are out of their mind. So psychiatry. Dermatology. Okay, diseases of the skin. Contrary to popular belief, dermatologists are not just pagwapo and pagwapa. They also deal with skin infections and diseases of the skin that are hard to treat and not just aesthetic or aesthetic meaning pagwapo, pagwapa lang. What else? Actually, there are still more. Infectious diseases, rheumatology or those pertaining to the joints, immunology, those pertaining to the immune system, allergology, those pertaining to allergies, oncology, cancer, and others. Okay? Because there are a lot of fields in medicine that we cannot cover in just one lecture. Pero, for example, if these subspecialties apply to adult medicine, it can also apply to children medicine. That's what we call pediatrics. Pediatrics, if you're in the US, pero kung namo sa Pilipinas, pediatrics. Okay, so pediatrics. So like in the adult medicine, no, we have pediatric neurology, pediatric cardiology, pediatric nephrology, pediatric dermatology, pediatric gastroenterology, and so on and so forth. Okay, so later on, I will try to let you understand unsa man siya, how do you get into one specialty. By the way, when you say neurology, for example, or pediatrics, that's what we call in medicine a specialty. Okay? Specialty meaning you specialize or you train to become an expert in that one field. Why? It's very hard to become an expert in everything. In fact, it's impossible. So you might as well be an expert in one thing and someone else an expert in another thing. And when a patient comes in and then he has multiple diseases, that's why there are lots of patients who have multiple doctors who work together. Okay? Now, that was the medical field, the medical side of medicine. What do you say, medical or clinical? Kanang tambal lang, tambal. Pero aside from just giving medicines, doctors can also do surgeries. That's why we have the surgical field. We have general surgery. Usually they deal with anything that surgeries within the gastrointestinal tract or the skin, and not specialized. Pero if you want to specialize in surgery, you can go to neurosurgery. Who is the most famous neurosurgeon you know? Dr. Strange. he's even just a fictional character, no? Pero he's the most pinakasikat. What else? Aside from neurosurgery, we have thoracic and cardiovascular surgery, or those who operate on the heart or blood vessels. Later on, I will tell you how long it takes to become a heart surgeon. Okay, we also have head and neck surgery. So for example, if you see people who have goiters or tumors in the neck and the head, so you go to surgeons who specialize in head and neck surgery. Also, these people who are head and neck surgeons are also the what we call the ENTs, or the ENT, ears, nose, throat. The medical term for that is otorhinolaryngology, ORL. Okay? Oto meaning ear, rhino meaning nose, laryngo, throat. Okay, what else? We also have plastic surgery. Who is the most famous plastic surgeon you know?
Vicky Bello.
Hidden ko?
Vicky Bello.
Alam mo hidden ko?
Yeah. Vicky Bello.
Okay. So plastic surgeons, also contrary to popular belief, plastic surgeons do not just make you more beautiful or more handsome. Plastic surgeons are also the ones who repair the skin. For example, in patients who suffer burns, mga patients nga nasunog, for example, na-deform ang face, inana, no? So these plastic surgeons work on the face or the skin. It's actually a sub-specialty, plastic surgery plus reconstructive plastic surgery. What else? We also have orthopedics or orthopedic surgery. Ortho, unsa man ang ortho? Those who deal with bones. So, if you want to become a doctor and you want to earn a lot here in Bukidnon, be an orthopedic surgeon. Why? Every day na ay madisgrasya. So, na ay mabalian o bukog. So, na-adjure yung pasyente always. Okay? So actually there are
Nakoy
even
kaila or to
a lot more of
specialized
ophthalmology or eye surgeons, those who operate on the eyes. I already
Nag-train na siya sa
mentioned
US.
ENT or otorhinolaryngology. We also have colorectal surgery or surgeons who specialize only in with the colon and the rectum. What else? We also have the new one, MIS. Actually, dili siya new. New lang sa ato sa Pilipinas, pero in other countries, especially in first world countries, it has already been the norm. Minimally invasive surgeries or robotic surgery and trauma surgery. Trauma surgery, those who deal with surgeries na emergency, na for example, di ka na-disgrasya and then grabe ka morbid, so the trauma surgeons are the ones we call in. In the Philippines, we only have less than 10 trauma surgeons. And there is no training for trauma surgery in the Philippines. The nearest one is in Israel. And others. Okay, so what else? We also have special areas. What are these special areas? I don't know why women are very special. Are they? Yes, they are very special. That is why they have a special field of medicine for them. We have obstetrics. Obstetrics pertain to those doctors who... obstetrics is the field where ang patients are those who are pregnant. Okay, so that is obstetrics. What is gynecology? Unsa iyang difference sa obstetrics? Because the people we know are OB-GYNs, di ba? OB-GYN stands for obstetrician gynecologist, obstetrics and gynecology. Now, obstetrics refers to the field where the patients are all buntis. Okay? Gynecology, ang patients, the field is for women's diseases. Why women's diseases? For example, cervical cancer. Cervical cancer is sexist. Why? It only happens in women. Malamang. Kaya wala may cervix ang mga men. Di ba? Oh. Vaginal cancer or vaginal cancer. Of course, gynecologist ka makatreat ani. Wala man sa lalaki. Di ba? Okay. So we have obstetrics and gynecology. And what else? We also have anesthesiology. Anesthesiology are not just surgeons' assistants. Anesthesiologists are doctors who take care of a patient during surgery. So while a surgeon is doing his thing, doing a surgery, it is the anesthesiologist's job to keep the patient alive until the surgery is done. Why? Because during the if a person or a patient has to undergo surgery, kinahanglan mag-make ug cut, kinahanglan magsamad, di ba? Matisting na masamad, di ba sakit? Sakit magaming walay samad, anak pa na samad, di ba? Okay, so kung naay samad, sakit. Now, para walay sakit, ang anesthesiologist maghatag og anesthesia. What does the anesthesia do? The anesthesia or anesthetic is a medicine that numbs your nerves. It numbs your nerves. It deactivates your nerves, bali ba, so that you won't feel a thing. Aside from that, aside from removing the feeling of pain, it also relaxes the muscles. Now, the problem is, kung mag-relax yung muscles, especially the diaphragm, you will stop breathing. Diba? So, that becomes a problem. That is why anesthesiologists are there to keep you alive even when you are under anesthesia. So, you will not feel anything and you will still be alive until the surgery is done. So, okay, so muna siyang anesthesiologists. We also have emergency medicine. Those who specialize in emergencies. Okay, so this is one of the very interesting fields of medicine. Why? because you get to, the patients you get to see are patients na you don't know anything about. Why? Kanang, they come to you and they are not your previous patients. So almost always they are new patients and they are dying. And you don't know anything about them. So it becomes a challenge. This is a very challenging field because you just get to revive the patient or resuscitate the patient. And then once ma-revive na siya, your work is done. You pass it to the next doctor. Kung kinsa kitong iyang doctor ginadaan. Okay? But this is very thrilling, very challenging, and always uga imong bakba tungod sa adrenaline rush. These are also the doctors who are being called during mga mass accidents. Like for example, the 9/11 or na bombing na diri na suicide bomber dito. The emergency doctors are the ones who go to the scene and rescue. So actually, appeal diri sa emergency medicine ang mga rescue. So you get to ride helicopters and choppers and everything. So that's why it's very interesting. Okay? So we also have sports medicine. Sports medicine, Doc, kisa katanaw ga subaybay sa NBA 3. Okay, so all teams have resident sports physicians. Each team has its own medical team. Now these teams are made up of sports physicians or physicians who specialize in sports medicine. So what do? They just make sure that the athletes of the team are always fit and ready to play. And if not, and if they need treatment, sila ang mag-treat. So usually they are orthopedics who underwent sports medicine, or family doctors or emergency doctors who underwent sports medicine. So every time na ay sports injury, that's what they do. Of course, those who are involved in the military. Okay? So now, and we have a lot more. School medicine, occupational medicine, critical care, or those who are just in the ICU, community medicine, alternative medicine, preventive medicine, forensic medicine. You know forensic medicine for those who watch CSI, for example, and others. Okay? So there are actually a lot more. Now, I already told you what it is to be what a doctor does usually, no? But why should you not become a doctor? Why not? Why? Let me tell you why. First of all, excuse me. It takes a very long time to become a doctor. Why very long? Okay, so medical school is actually a postgraduate course. What does postgraduate mean? It means dapat humana ka college ay saka mag-doktor. So I have to tell you this. Why? I-appeal siya sa inyong career guidance so that you will know na kung gusto mo mag-doktor, dapat humana mo college. Ay, dili na pwede mag-diretso. There are only two schools in the Philippines that offer straight programs for medical course, straight out of senior high school. Only
UP
the University of the Philippines,
UST.
PGH, the Intarmed,
UST.
and I think
US.
LaSalle. De La Salle.
Wrong
De
UST
La Salle
ka mag-offer po
University.
sila.
Okay? So,
O, bago.
pero if you want to go straight to a medical course straight from high school, you have to be
The best.
in the top 100 in the UPCAT. If you are not top 100 sa UPCAT, they will not accept you. So, the other course, which is the usual course, is to go to college finish a 4 or 5 year course, and then apply for medical school. So it's a postgraduate course. Meaning, again, dapat mag-college sa mo ay sa mo mag-medicine. Speakers who will be telling you courses you might want to be interested in before you enter the medical course. Okay? So now, how long does it take? This is supposedly a table that shows how many years it takes to become a doctor. Elementary, 6 years. Kung wala ka nagundang. Junior high school is 4 years. Senior high school is 2 years. That's how many na? 6 plus 4, 10 plus 2, 12 years. And then, you have to take a college course.
4 years.
A Bachelor of Science in anything. So, if you ask me, unsa ka nga, unsa to nga strand ang pwede para mag-doctor ko doc, unsa pwede nga strand. Actually, wala ko kaabot ang strand. Sa amuang time, walay strand pa. Pero, from what I know of, medical schools usually will accept applicants who are from the STEM strand. Pero not just actually STEM strand, because I also have, what is STEM? Mga BS Bio, BS Biology, BS Chemistry, BS Physics, ano ba? Okay. Pero aside from that, I also have a classmate who is a CPA or an accountant. I also have, what strand is that? ABN. Oh. I also have a classmate who is a teacher. Isa na strand? Gas. Oh. So actually, nagan ko classmate nga Bachelor of Music, pero well, of course, wala siya kapasar. Isa ka human. Pero pwede good if you really want it. It's not impossible. I have a classmate who is BS Math. Pero, STEM no? BS Math. Pero doctor na siya karon, is even one of the top of the class. But so that's college, 4 to 5 years. Ano 4 to 5? Ako ko yung classmate ng engineer. Din ako classmate. Lahit siya na engineer siya. I even have a student now who is BS Geology. Nag-medicine siya. So actually, you can come from any, basta nakahuman mo college, 4 to 5 years. Ano man, di ba CPA is 5 years?
5 years.
Oh.
5.
4 na? Okay. Engineering courses are 5 years. So, now, after college, you might want to take your board exam pa? Pwede. Pero if not, you want to proceed, so you apply to medical school. Before you go to medical school in the Philippines, you have to take the NMAT or the National Medical Admission Test. That is a national admission test, no? It is done in LaSalle, in Santo Tomas, in UP, and it's like a board exam. But anyway, you have to apply for it. And they will give you a rating. Now, what is your rating for? Medical schools have a cut-off sa ilang rating. For example, kami nga medical school, we will not accept applicants whose NMAT scores are 80 and below. UP, PGH, College of Medicine, will only accept you if your NMAT is, they say it's 95 and above.
Wow.
Pero I have nakoy kauban na classmate nako na classmate nako siya because she applied to UP and she was not admitted. Her NMAT was 98.
Wow.
Okay, what else? Medical school. Medical school is 4 years, okay? Once you are able to enter medical school, you will be in it for four very long years. After that, you will have 1 year of internship at any hospital of choice before you can take the board exams for medicine. So, pila na? 6 plus 4 plus 2, 12 plus 4, 16 plus 5, 21. Kung makapasar ka sa boards, doctor na ka. Doctor of Medicine na ka. After how many years of schooling? 21 years. Pero let's count it from high school. College. 4 plus 4, 9, 8 plus 1, 9. So 9 to 10 years after high school. After senior high school, ha? After senior high school, it will take you around 9 to 10 years before you can be a doctor like what I am now. And then after that, doctor ka, you are general practice pa. You might want to, of course, you might want. You will want to specialize. For example, Doc, gusto ko magpedya. Mga lalaki, Doc, gusto ko mag-ubigay ni. Okay, so you will undergo specialty training. Now, how long is a specialty training? Ito ang residency training. It depends. Kung pediatrics, 3 years. Kung internal medicine, 3 years. Dermatology is 3 years. OB-GYN is 4 years. ENT is 4 years. Ophthalmology is 4 years. Orthopedics is 4 years. General surgery is 5 years. And other surgical fields are 5 years. Kung general surgery. However, pag humani mong surgery, gusto ko mag-thoracic surgeon, heart surgeon, another 5 years. So pila na? Med school, 4. PGI, 1, 5. General surgeon ko, 1, 2, 3, 4, 5, 10. Gusto ko ko mag-heart surgeon, 1, 2, 3, 4, 5. 15 years after high school. After senior high school. So, sa man, gusto ko mag-doctor. So, the total number of years it takes for you to become a specialist, it might take you 26 to 33 years to become a doctor of medicine who specializes in a specialty or a field of medicine. Oh, gubot na. So that's how long it takes. Dugay na? Dok, ano sa kamabinyo? Ambot ninyo. Pili po na magninyo. Isabot kami. Okay. Aside from it being very long or taking so long, it's also very
expensive.
Stressful. I will not say it's very difficult. It's not actually the difficulty that matters because ang difficulty depends man, dili man siya difficult kung mag-study ka, pero it is very hago kayo siya. Bali, it's very tiring, it's very exhausting. It's actually, ang time and the workload is what will quote-unquote kill you. Why? Sa med school pa lang niya, this is just an overview of
subjects.
The med school. First year in med school, remember this is after college na ha? First year in med school, it's called Basic Biomedical Sciences. What subjects do you have? We have anatomy, physiology, biochemistry. What else is there?
Histology.
Radiology 1, patient-doctor relations, and then family and community medicine. And per subject, you don't just have one book. You have to have at least 3 books to read. Why? Because authors have different opinions. Diba? So you will have to read at least 3 books for one subject.
Check.
4 types of sex. Okay. So, daghan na kay kagbatahon nun sa first year pa lang. And then you only have actually 4, 5, 6, 7 subjects lang na siya. When you get to second year, para clinical, dugangan na po na siya o mga pathology, microbiology, parasitology, etc. You have surgery and everything. When you go to third year, diyan na mag-start ang specialty. You will already study pediatrics, OB, gynae, surgery, and those subjects, no? And then you will already have your junior clerkship. Pag fourth year, this is what they call, you will become the lowest form of animal. Lowest form of animal. Nga naman, fourth year of medical school, wala na yung klase. Wala na yung klase. Kung saan man, duty. Duty na ka 365 days.
Wow.
365 days. So it's divided actually. For example, you will rotate in the Department of Pediatrics for 61 days. Department of Surgery, 61 days. Department of Internal Medicine, another 61 days. Department of OB-GYN, 61 days. And then you will have at least 20 days per minor rotation. You have psychiatry, OPSA, ENT, nga na, no? A total of 365 days.
Wow.
Promise, it will be very tiring. Why? No weekends off. That's why if you ask fourth year medical students what day it is, they will not know. Because it would not matter. What else? No holiday off. That means you will be spending Christmas and New Year and birthdays with your patients in the hospital and not at home. Unless if you're a mama's boy or a papa's girl and they go to the hospital to visit you. We will go to see you for a few minutes. Why? Tawago naman ka, paging, senior clerk, please go to the emergency room now. So, 365 days na puros trabaho. And aside from that, work shifts are not like your work shifts. There is no such thing as an 8-hour shift. Why? That one. That's actually my weekly schedule when I was in fourth year.
Wow,
So what is that? I have 24 hours of duty every 3 days. Meaning, I time in at 7 a.m. I time out at 7 a.m. the next day. Pero, for the next day, for example, Monday, time in ko 7 a.m. Pagka Tuesday, time out ko 7 a.m. 24 hours naman. Pero mag-time in asat ko for that day, Tuesday. For the second day. Meaning, nag-time in ako ko the same day. Actually, wala ko nag-time out. I'm just telling you para masunod ninyo. And then, I will finish all my work. I will see all the patients I admitted until mahuman. What time man usually mahuman, Dok? Depende. Alas 5, alas 7, sa gabi. Pinakadugay na ko, alas 2 sa kaadlawon. Meaning, pila na ko hours? 36, 48 hours. Nawalay tulog. 42 hours nawalay tulog. And then I have to sleep until 6 a.m. because I have to duty again the next day. So actually, I don't know if you're going to get discouraged, pero that's how it is. Why? You're being trained to be on call. Why? Dili man pwede nga nagbakasyon ka, nagtanaw mo sa ini sa imuhang palalabs. Nawag dahil ang imuhang nurse, Dok, may mga anak. So man imo ingon, unya na, wala pa nahuman. I-cancel na sana. Pwede ba dahil nga? Dok, nigawas na ginang ulo, Dok. Ibalik. Kaya wala pa nahuman ang salida. So whatever it is you're doing, you have to live what actually it goes down to priority. This is actually an actual picture of a doctor who was seen sa sidewalk nga naghilak. Did you see that in Facebook? It went viral. He just lost a patient in the emergency room after 9 hours of trying to revive the patient. Still, wala. Namatay din. So he went out and he cried. Hindi nakakita sa iya. Actually, doctors are also humans, no? So, because of the long duration, it's very expensive. How much ba ang tuition karon sa kung gusto ka mag-doctor? You will need just an estimate if I can still remember correctly. I think in DMSF in Davao, it's 115,000 pesos per SEM. How many semesters do we have? 2. Oh. Wala pa'y labot ang libro, wala pa'y labot ang uniform, wala pa'y labot imong boarding house. Pati imong food. Nga naman, you will have actually, the biggest bulk of your allowance will go to food because you will not want to study at home. Why? You will fall asleep. So you will want to study where? Starbucks.
Wow.
Coffee bean. Mahal kayo yung kape. Kapila ang kape? 150. Ang isa kabuk baso. Kapila yung imnon. Tulo. Ano man? Tulugon man gihapon ka. Okay, it's very difficult. You will have less time with your loved ones. You will not be able to sleep well. Why? You know why. You will have extreme changes in weight. I used to weigh 70 kilograms before. I reached up to 86. Okay, isa pa, bullying by your seniors. Frequent encounters with death. And it's very stressful. So the question is, do you still want to become a doctor? Why should you? Okay, so many people go to the medical course because of, number one, it's prestige. Kung doktor ka, especially kung nakaputi bitaw kag coat, magtaas kayong tanaw sa tao sa iyo. What else? The prestige, the respect. Of course, even the older people will go to you, Doc, salamat kayo to. Di ba, anak mo, respeto yun sila. Basta kapalo sila na doktor. Of course, especially katong kapalo ko kung sa'yo naagian sa doktor. Respect. You get to have challenging tasks. You get to be challenged every day. Especially with illnesses na, wala man ni sa libro. Lahat man to nakabutang sa libro. Unsa kaha ni. So you get to think and research things that could not be found in the textbooks. Challenging tasks.
Next.
Okay, financial reward. Disclaimer. Not all doctors are rich. But walay doktor nga pobre. So not all doctors are rich, but walay doktor nga pobre. Ano man, because of what you've been through, naadyo'y pamaagi nga magka-cashin ang mata. Especially if you're in it for the business. So I hope you do not become doctors for the business. Okay? But what is more important here, what is better here are the opportunities. You have opportunities for continued learning because like I said, or what I've been telling you, you don't stop studying, di ba? Pila to? 26 to 33 years. And then every year na i-update, ano man, it was discovered that this medicine does not work anymore, so you have to change it. Every year it may change. There are changes every year. Opportunities to serve. So you will get to serve people, especially katong walay mga dili makabayad or katong dili ka afford, pero you will have the opportunity to serve them. Most of the time, many times pro bono or without pay. And this is what actually motivated me to keep going. You get the opportunity to save a life. Not just actually a life. You get opportunities to save lots of lives. Especially those innocent lives, no? And opportunities to encounter new life. Especially if ikaw ang nag-catch sa baby, ikaw ang nagsalo sa baby after a delivery. Especially those difficult deliveries. Katong kinahanglan yung cesarean, kay dili ka agi sa sakit nga. So you have opportunities to encounter new life. Opportunities to appreciate life. Like when you are around old people at geriatric homes, you get to appreciate life with them. And personal fulfillment. This is actually a picture of a doctor hugging a cancer patient who survived cancer. So nothing beats the feeling of fulfillment when a mother comes to you and tuk-tuk yung mong quarters, ayaw na si doktor diha, ano man, Dok, and then she burst into tears. Dok, salamat kaayo kay na iayo ni mo akong anak. Sometimes they send you a love letter, ano pa kanang sa reseta, sa likod bitaw sa reseta, nakabutang ito, thank you kaayo doktor. Yung spelling pag ako ngalan, pero may mo nang lisod sa akong apelido. Pero it does not matter even if wrong spelling siya. The fact that they are grateful and they thank you. And then usahay, they come to you, nanang po na ikaw, pa-check up na po ka, ay wala dok, nagdala lang po. There she was, nagdala ang basket, puno ng gulay. Hindi na po supply gulay 1 week. Do you really want to become a doctor? Despite the kalisod and kadugay, pero these are the opportunities you can have. Remember lang ha, this medical course is one thing you will consider. Of course, you will have to consider it now, pero you cannot go straight pa. So you have to choose a pre-med course that can fit the medical course. So, unsa man ang mga pre-med course na pwede advantage siya sa medicine? Actually, you all start from scratch when you enter medical school. Pero of course, like for example, kung nurse ka, you will already have had encounters with the patient, so mas comfortable ka with patients. Kung medtech ka, for example, then siguro second year will be a bit easier for you because microscopes will be your kinalakan every day. If you are BS Bio, cell biology is the first topic in the first day of class in medical school. Pero I think it will not really matter. What will matter much is if you are really motivated. Because during the times nga kapoy na kay ka, you feel like giving up, what will be there, what will be left? Will only be your motivation. So motivation can come in many ways. It can be your drive to really become a doctor because it's really what you want. Maybe you feel that it is your calling. What else? Maybe your motivation can be your loved ones pushing you. Maybe your motivation can be your future patients who are waiting for you. So motivation is key. But I would like to end this with a verse. So, no matter what your plans are, a person may make many plans, but it is the Lord's purpose for him that will be carried out. So, my advice to you is, try to know kung sa ka ang purpose ng Lord sa ako. And then, it will be much easier for you. Why? That will be motivation in itself. How will you know the Lord's purpose? Dapat close with mo ni Lord para kabalo ka. Di ba? So, I end my talk there and thank you very much and good morning once again.